These are COVID-19 vaccination clinics set up across Africa. The fact that clinics like these are able to offer vaccines is a result of the COVAX initiative, which brought Western countries together to provide access for lower income nations. Many countries queued up to receive shipments, but there were limited supplies as Western nations bought up vaccines independently to use for their own populations. Today, however, there's no longer a problem of supply, but instead an issue centred around demand, as many poorer nations have begun to struggle to use all the vaccines allocated to them. A range of factors are said to explain this, but one reason is clear: vaccine hesitancy. Take Cameroon, for example. Here, a 2020 survey found up to 85% were vaccine hesitant. During the Ebola outbreak in West Africa, a similar problem was faced, as some communities refused treatment, suspicious of Western medicine. There's many reasons behind these issues of medical mistrust, but one potential cause can be traced back to the actions of Western colonizers decades ago. In the early 1900s, nations in Central Africa were faced with large outbreaks of sleeping sickness, a disease transmitted by the bite of the tsetse fly. In former French Equatorial Africa and Cameroon, the colonial government was determined to tackle this disease, to save lives, but also to further their knowledge of tropical medicine and ensure a healthy labour force. The French military set up a large number of mobile medical teams who visited rural African villages to provide treatment. But, while their intentions might sound noble, their actions were far from it. Treatments for sleeping sickness at the time had serious side effects, including blindness, gangrene, and death. Despite this, the campaigns repeatedly forced individuals, sometimes at gunpoint, to receive treatment. This got economists Sara Lowes and Eduardo Monteiro thinking regarding the effects of these campaigns on medical mistrust today.
So when we read about sort of this history, we were like, wow, like when we think about what might build trust in the medical sector, this is not it.
They soon created a hypothesis. They predicted that those areas which faced greater exposure to the medical campaigns would be the same areas which had more medical mistrust today.
And so we were interested in then trying to document sort of when and where these campaigns happened and seeing if we could link that to present day trust in medicine, basically.
So they had a theory. Now they had to find the data. They travelled to military archives in Provence, a region in southeastern France, in order to find the data they needed.
We went to the military archives and basically just had to digitize a lot of their historical records on how these campaigns were implemented, when they were implemented, what types of activities they were doing.
Within the military archives, they found data on the number of visits these medical campaigns made to different areas in French Equatorial Africa. But there was an issue. None of this data was digitized.
Once you take photos of all of these historical records, then you have to turn them into data we can actually use. And so that required a lot of time. So basically hiring people to enter the data into spreadsheets and then organizing that data in a way that we could analyze it.
So they had the data they needed in a form which they could analyze. They could now finally test their theory. To start to understand what they found, we have to look at these two charts. The first compares the level of vaccinations today to exposure to the colonial medical campaigns. Along the x-axis is the share of years communities were visited. The further to the right, the more times the French medical teams visited. Along the y-axis is the average share of vaccinations completed for children in that community today. Add in the data and we can start to see a trend. Those communities visited many times by French colonial medical teams are less likely to vaccinate their children today. If we look instead at the likelihood to refuse a blood test, we can see a similar effect. Individuals living in communities which were not exposed to many visits were less likely to refuse the test, whilst those living in communities visited many times were much more likely to refuse. Therefore, as Sara and Eduardo predicted, the colonial medical campaigns did have an impact on medical mistrust in Africa today. What's more, World Bank projects which aim to improve healthcare across Africa are consistently less successful in the areas affected by the campaigns. And so, the problem of medical mistrust, in some areas at least, can be traced back to the effects of the French military campaigns. If we truly want to help low-income nations develop, then we have to acknowledge the actions Western colonisers took decades ago, and the effects these actions might still have today. Thank you to Sara Lowes for her support as part of this project. Please watch further videos in our series delivered by Discover Economics and Cage Research Centre. Please visit our website and follow us on social media.